We are joined now by Jessie Hallaby. She is a board member with the Atlanta Women's Foundation. She joins us now live. Jessie, can you hear us all right?
Yes, I can, Zach.
Thank you for making the time. I understand that your organization is paying close attention to a new report came out on Friday analyzing mental health impacts and conditions among women and girls, particularly right here in the metro area.
Yes, absolutely. The Atlanta Women's Foundation commissioned some research to get a comprehensive assessment of the mental health needs in the metro Atlanta area surrounding our five counties of Gwinnett, Fulton, DeKalb, Cobb, and Clayton counties. And what we found is that, mental health challenges are really being driven by economic stress in our communities.
There's so much to unpack anytime we have a conversation about mental health and mental health here in Atlanta and more broadly. Let's start here. Was there anything just right off the top that surprised you when you got the results of that study?
Maybe not so much surprising because I'm a mental health therapist, but the research really solidified everything that providers in our communities are seeing in the communities. So it really elevates the experience that providers are seeing every day. 100% of the nonprofit providers say that economic stress drives mental health challenges. 90% of us are seeing anxiety, 83% depression, depressive symptoms, trauma, and suicidal risk are also of elevated concern in our communities.
You point to economic factors. Has that grown as a driver of mental health challenges over the years?
Well, these are all issues that are pretty common in these areas. However, housing instability, increasing financial pressures, lack of access to resources, those types of things are certainly elevated in our communities.
And what other factors did your report find are points of, I don't want to say alarm necessarily, but points of focus in this mental health conversation? And I'm sure you've seen these in your own practice as well, since this is your practice area.
Yes, yes, absolutely. So other areas, particularly youth mental health, our youth are carrying struggles, typically alone. And that emotional isolation is really a quiet driver of increased mental health crisis. Maternal mental health is another area that was highlighted. Maternal mental health is foundational, to our families' well-being, and supporting mothers is quite important in order to create family stability and stability in our communities. And also, we can't ignore the workforce of our mental health workers. They experience burnout, and that's also a hidden challenge that came to light in this research.
I want to ask you about some potential solutions and coping mechanisms in a moment, but before we get there, I want to ask you this. This was a study that particularly focused on women and young women. Are there certain factors that are more acute challenges for them than for men?
Yes, certainly. So, of course, the Atlanta Women's Foundation is the only public foundation in Georgia dedicated to working on behalf of women and girls. Um, and so that was our primary focus. But women, as being head of households, we face transportation barriers, childcare responsibilities. Sometimes there are insurance limitations. As women are running their households and have caregiving and family responsibilities, it affects the effects of those things, affect women and girls who are also given household responsibilities a little bit differently than it does for others.
Does technology play a role in this conversation at all? Anecdotally, I hear so often from people, even in my own life, that feel like it is so hard to pull away from distractions, things that stress them out, things that live right on their phone, even though, and I'm guilty of this too, I know it's not the best for my mental health. It's hard to pull away and exacerbates some of those tough feelings that everybody wrestles with in one way or another.
Yeah, absolutely. Taking a break from social media is vitally important to give yourself rest. And it's part really of contributing to your self care. So, yes, technology is contributing more and more to our mental health challenges, I would say.
And I don't want to be accused of being a hypocrite here. I mean, I'm sitting here with two telephones. Probably not the best way
I get
to
it.
be,
It's tough.
And it's a modern world. We're all juggling with this. Listen, we've talked about some of the challenges. We've talked about some of the focus areas of your practice. Let's talk about solutions now for somebody who may be watching this and maybe is hearing this conversation, maybe read the report and went, "Oh yeah, this is talking about me." What can people do to get some help if they need it?
Well, definitely reaching out to your nonprofit community providers. Um, but the other thing we want to touch on is access to services, right? Only 23% of our nonprofit providers offer integrated care. And oftentimes that means that women are having to choose for their families whether or not to take care of their mental health needs or their family's needs. Oftentimes if we are worried about, paying rent, putting food on the table, that's a difficult choice. And so we are not able to access, make that choice to access services just for our mental health. So addressing housing instability, financial pressures, addressing those are also part of contributing to positive mental health.
All right, I think that's a good place to end it. Jessie Hallaby, a board member with the Atlanta Women's Foundation. Thank you so much for your time and for your perspective.
Thank you so much, Zach, for having me.